Good afternoon. Thank you for joining us this afternoon for our daily conference. A couple comments before we introduce the guest today. Most would agree that it may be premature to attempt a full restart of the economy, but I do believe that we are all encouraged by increasing discussions at the state and national level to outline a path for a phased comeback. We now know that there will be increased testing, including here in Peoria, which is very welcome. This will provide scientific evidence that communities are in fact seeing a downward trajectory of COVID cases and similar downward trajectory of positive tests before being allowed to begin phasing in a back-to-work plan, which is what we're hoping to see. We're hopeful that communities with smaller and less dense populations who have worked especially hard with our healthcare professionals and practiced strong isolation techniques like we have in Peoria will have ourselves positioned to begin making that comeback sooner rather than later. But don't let these focused efforts over the last month go to waste by discontinuing safe procedures now. Maybe more than ever, this next week or two is the most important time for us to all ensure that we have suppressed COVID-19 in Central Illinois. I believe that most of us are very conscientious and will self-regulate our behaviors as our economies begin to move back to real life again. I don't think anyone really knows what the new normal will be, but I do know that we'll be closer to finding out if we continue to work together to stay safe and protect our frontline healthcare systems from any dramatic surges down the road. Especially with warmer spring weather approaching, I urge all of us to continue to avoid socializing in groups of any size and practice good hygiene. Do everything that you can to protect the most vulnerable, and remember that there are a whole lot of our family, our friends, and our neighbors who are struggling through this. Please do whatever you can do to help them and all of us get through this together. Our region's performance has been very strong due to diligent planning efforts over many years, and that's one of the main reasons that Central Illinois has been more successful than many others in combating COVID to this point. Please don't be complacent now. Focus on getting to the other side of this situation and do what every one of us has to do to get there safely. I know, speaking on behalf of Chairman Rand, who is here today, and also Chairman Zimmerman and Krug, that we're all getting a lot of phone calls from anxious small business people who are really ready to get back to work, and we hear you. And we're doing everything we possibly can to help assist you. We understand the struggles that the small businesses are having, as well as speaking for all the employees who they provide for and help them put food on the table. And we want to work with you as hard as we can. We understand the challenges with the PPP. The city of Peoria and the county of Peoria is struggling very much too, because we have not got any direct support from the Fed. So we're in the same situation that a lot of the small businesses are. We're going to continue to fight for that, and we're going to continue to fight for you. Now I'd like to introduce Monica Hendrickson.
Good afternoon, and thank you, Mayor Ardis, for that reminder about the focus in the next 2 weeks that we need to have. To begin today's briefing, I'd like to give a to-date total for Friday, April 17th. The Tri-County region is reporting 68 cases to date. Peoria County is reporting 34 cases, reporting one new death associated to COVID-19, a woman in her 80s. Tazewell County is reporting 23 cases, and Woodford County is reporting 11 cases. That brings the to-date total for deaths at 5. The hospital systems of OSF St. Francis Medical Center, Unique Point Health Methodist, Proctor, and Pekin report 20 ICU beds in use, 8 for individuals confirmed with COVID-19, and 12 for persons under investigation for COVID-19. In addition, they are reporting 21 non-ICU beds in use for either confirmed or persons under investigation. Peoria County remains at 34 for cases, and the demographics remain the same. However, there is an update to the status of our cases. 15 have recovered, 14 are at home and self-isolating, and 3 are hospitalized. The Peoria City County Health Department, in coordination with the Peoria County GIS, now has on our COVID-19 website a dashboard providing data on COVID cases as well as testing. The interface not only allows those working within the response and policy makers additional data, but also allows the public a better understanding and access to information. The dashboard is set up to allow individuals to review data. On the left of it, the screen, is information regarding confirmed cases. So as you can see, we have 34 confirmed cases. Below that are test results, which looks at the percent of positives out of all of our tests that have been identified and provided information to the local health department. And then below that is the confirmed cases to date as well as the growth. One of the key measures about removing restrictions is understanding the growth of cases over time. And that's why this type of information is very useful for us to understand the situation we're at. On the far right, you'll see that there are demographics in regards to gender, race, and age group for both the tests that we know of as well as our confirmed cases. And you would be able to toggle between both entities. And then lastly in the middle is information regarding testing and cases by location, specifically zip codes. You can see that testing data is also available on where testing has been located in terms of where individuals are residing at the time of test. For cases that have a count of under 5, that information in terms of zip code will not be made available. Again, we consider that identifiable data. The data reflects all known confirmed positive tests, but our overall testing data, which includes negative tests, is limited to those labs that are able to provide that information electronically into the state of Illinois' Notifiable Electronic Disease Surveillance System, or INEDS. So while all positive tests, regardless of where they're collected, are provided to local health departments, the same is not true for negative tests. This further highlights the importance of testing. Yesterday, the governor spoke of increased testing throughout the state, and a key champion in providing that support here locally is Representative Jehan Gordon-Booth.
Thank you, Monica. Your leadership has been incredible throughout this time period. We are incredibly blessed to have a wonderful healthcare professional like Monica, who is not only incredibly brilliant and compassionate but by trade. She is an epidemiologist, and I can't think of any better time to have an epidemiologist on staff here at Peoria County. In the days and weeks, we will continue to come together in ways that will continue to define us as a generation. That we picked up the phone to call our elderly neighbor. That those of us that were healthy decided to go out and ensure that the citizens in our community that aren't able to go to the grocery store are able to have nutrition for their families. To those of us that travel at dawn to go stock the shelves at the grocery stores, we see you. To those that keep their families and their children safe inside and making them to continue to feel hopeful, even when they are afraid themselves, we see you. To the nurses, to all the hospital staff that have to isolate themselves from their own families when they go home, to the hospital staff that are FaceTiming their family after doing a 15-hour day because they are afraid of transmission at home, we see you. To all of those out there that lose their life to this virus, to their loved ones that may lose their life to this virus, we see you. To the first responders, to the folks that are on the front line every single day in this community, we see you. And not only do we see you, we hear you. What the leadership here in Peoria County and this entire region is saying is that we see you and we hear you. And in that spirit, I want to thank Governor J.B. Pritzker, Deputy Governor Sol Flores, and all of my colleagues in the Illinois Legislative Black Caucus that was successful in the advocacy of building out a robust testing apparatus throughout the state of Illinois in vulnerable communities across the state. Obviously, we want to get back to as much of a normal life as possible. But what we all know is that there is going to be a new normal for the foreseeable future. But the only way that we will have the ability to chart a new way forward is through robust testing in our communities and contact tracing and mitigation in our communities. And now, with the amazing healthcare apparatus that we have here in this region, and with an amazing partner like Heartland, we actually have the ability to do something that so many communities, not just across the state of Illinois, but so many communities across this country wants to have exactly what we have here in Peoria. And it's an exciting day to be here to stand with the local partners that are going to be leading the effort to ensure that the individuals in this community have access to COVID testing in a way that has not been available up until this point. We're looking at setting up sites in some of the most needy portions of this community to ensure that those vulnerable populations have the ability to be tested. And hopefully after testing, we will have the ability to do the proper isolation of said individuals. And we will begin to get on a path of moving into this new normal until the date that there is a vaccine or until there is medication that properly treats this ugly virus. And so I am here as one of many who has worked on this issue for quite some time, but I can tell you that I've never been more proud in my time as a legislator serving this community than I am today, to know that the work that's going to be done, not by me, but the healthcare professionals in this community that do this work every day, they are leading this effort, and they are leading the work that's going to ensure the safety and the health care of the citizens of our community. And so I'm proud to say that Peoria is ready to stand up a robust testing operation right here in our community. And with no further ado, I believe Dr. Sharon Adams would be here to add any additional questions and or information about what the testing apparatus will look like here in Peoria County.
Good afternoon, everyone. I am so happy to be here. We are so excited about this new endeavor that we're able to participate with partners, with a lot of different partners here in the city. Heartland Health Services, we're pleased to announce that we will have 3 collection sites. Our first one will open on Tuesday, the 21st. It will be at our East Bluff site, which is 2321 North Wisconsin Avenue. The hours of operation will be 9 to 4 Monday through Friday and 9 to 12 on Saturday. Our second site will open up on April 25th, which is a Saturday. It will be here at this location. As you know, we have a clinic here normally. We will be doing weekend hours here, Saturday and Sunday. I believe it's 10 to 2. And then our third clinic or collection site will open on April 27th. We have a clinic at off of John Gwen, the Carver Clinic. The parking lot is too small to do it there, so we're actually partnering with the Park District to do it at the John H. Gwen Park, located at the Fawcett Field. So there's more room for drive-up for people looking for collection. We will have both drive-up and walk-up. There is testing criteria, kind of 4 different groups. One deals with shelter individuals, the homeless shelters. The second group deals with people with symptoms and known exposure. And the third group deals with chronic health conditions, those that have those conditions that put them at risk for complications from COVID. And the fourth group are frontline workers. These are the people that in the course of their work cannot socially distance. And that would include grocery store clerks, licensed child care facility workers, bus drivers, etc. So we are working very closely with the state on number of collection kits that we'll be able to get, or the amount we'll need. So we're very excited. Our thank you to Representative Jehan Gordon Booth. She has been instrumental in this. We're also partnering with the University of Illinois College of Medicine. They're very excited to work with us on this project. Of course, the health department. There's so many that we can't name them all, that we're very blessed to have this opportunity. We're very excited about it. And we do have a hotline. It will be opening at noon on Monday. That number, let me get that for you, is 309-495-8659. Again, that will be in operation about noon on Monday. So thank you very much.
Thank you. We'll open it up for questions from the group.
I know I have some for this.
For Sharon.
Monica?
Yes.
The 80-year-old woman, was she a resident of a nursing home? And if so, which one?
The 80-year-old woman was associated with our first death. They were close contacts.
So I know you said you were working with the state about the number of kits that would be at each site. Do you have a guess? Would it be similar to the McLean County site with like 250 a day? Any guess there?
I think we've asked to start with 150 a day per site, so that will be 450 a day that we'll have. So, but who I'm working with said, we're going to be in direct contact with them frequently, and if we need more or less, we can adjust.
And can you talk about the staffing for this? Where are all the staffing coming from? How many people would be at each site?
So we're working on the staffing model, but it'll be a lot of Heartland, and then it'll also be the University of Illinois College of Medicine as well.
These are the swab tests, correct?
Yes, these are the NP swabs, nasal pharyngeal. Mm-hmm.
So how exactly will they work? You mentioned both drive up and walk up. So let's say I walk up to, let's say this site on Sheridan, and it's on the weekend when it's open and testing's available. I mean, do I come inside to get my test? Do you administer to me outside? How does the whole setup work?
This will be outside, and we will actually have signage and barricades set up, so and clear signage on where you go. But it's intended to be outside as long as the weather holds. Yes.
Even the walk-up sites?
Yes.
So all of them are going to be outside?
Outside. Mm-hmm.
So if people come in here, they can park in the parking lot and then they walk into
No, it's all taking part outside.
Okay, so what if it rains?
Tents or, yeah, something else, yes.
Okay.
Mhm.
Can people sit in their cars if they want to?
The
or-
drive-up will be in their
And
cars.
There's only one drive-up, right?
Right,
Okay.
yeah, so they'll drive around to they first have to stop for the paperwork, questions, etc. Then they'll be directed to drive around to where the collection site is.
Okay. And then when you talk about the 4 groups of people that are going to be tested, when you talk about frontline workers, do they need to be sick or they're just worried?
Dr. Stoner, do you want to answer that?
Good afternoon. That's a great question. The criteria that the state has given us that we are supposed to operate with is that they are supposed to be symptomatic. Okay, all 4 groups are supposed to have symptoms. They've also given us some discretion, though, and said that we can use some judgment on that. And so particularly high-risk groups that may not have symptoms or that symptoms are very minor, we may be able to test. But it won't be testing like absolutely everybody that wants a test. Okay?
So just to clarify, so the governor's announcement yesterday that pulled up here is that San Jose Illinois recommended testing criteria to include all who are experiencing COVID-like symptoms. It will apply to state-run drive-through testing centers and will be offered to medical providers across Illinois. So is that criteria, aligned with what you've set here?
Exactly. Those are the criteria. The governor broke into 4 different groups, as Sharon had mentioned, and each group says they must have symptoms according to their criteria. Again, when we've confirmed this with the lab, they've said you can still use some discretion on this, but again, it will not be, and we're not encouraging it to be for someone who's just totally healthy with absolutely no symptoms. There just won't be enough kits to do that with everybody, unfortunately.
What precautions will the workers be taking at these sites?
They'll be in full protective gear, okay, with shields, masks, gowns, gloves, okay, and we'll have the people that are actually doing the part where they're obtaining the swab, the nasopharyngeal swab. That's considered an aerosol generating procedure, and when they do that, they will be with their fitted N95 masks instead of a regular surgical mask.
And then once the tests are completed, once you get the samples here, will you be sending to the state lab, private lab for analysis?
They're being sent to a lab in Pekin, which is, as I understand it, a private lab. Reditus. Okay, and they promise a response within 24 hours. And so we think that we'll get a very nice response from them, and they can handle their functioning 24/7. So, and they have courier service that will pick up these the samples from us. Those results will then come back to us as far as they first go to the health department. They see them first, so they can start their contact tracing and everything else. But the private physician or the physicians that order these will get their results back. The Heartland physicians and a physician in infectious disease at UE Comp, Dr. Kim, has agreed to accept all the results coming back from patients who are not Heartland patients to give some review to those patients also.
Will results be sent to a person's doctor if they have their own doctor?
Yes, absolutely.
And it's free?
It is free, is that right? For the patients, okay. Apparently, the rule is that we are, if they have insurance, the insurance is supposed to be billed. That's what we understood today, so. Okay. Okay, well, thank you.
I have a question for you, Monica.
Okay. Just before we go on, is there any other questions for Sharon or Dr. Stoner? We want to make sure we respect everyone's social distancing as well. I know there are some questions for Representative Gordon Booth, but if there is no other questions for Dr. Stoner and Sharon. Okay, thank you.
We're poised probably to get a flood of positives when this starts going into effect. are you hiring extra people at the health department to do contact tracing, which I would assume is a really labor-intensive kind of thing?
So the question is, with increased testing, there is a natural tendency to also then identify and increase positives, and so the contact tracing involved with that. Will there be changes in our hiring at the health department? Currently, the health department staff, the way we've set it up here at Peoria is that we have our main staff that does disease investigation, known as disease specialists, that have always been working on this routinely. What we have also done is pulled staff from different departments, specifically our environmental health department, to help support contact tracing. And so as this progresses and the caseload increases, we may be pulling staff from other departments to assist. And the reason why we selected our environmental health staff is because their training and background make them aptly suited for addressing investigation, whether it's for food establishments, but in this case, asking specific questions and be able to do that contact tracing. Other health departments in our community are partnering with the University of Illinois College of Medicine in Peoria to have students, medical students as well as residents, assist with some of the contact tracing. And again, recognizing the fact that not all health departments are the same size. We have smaller health departments and larger, and so we would like to be utilizing and making sure any additional assets go to those smaller health departments to help with their response efforts.
And just to clarify, Monica, this is not only available to Peoria County residents, or is it only available to Peoria County residents, the Peoria sites?
No, it's not just for Peoria County residents. That's a great question. This is open for our region. And I think that was a really key thing about bringing testing here regionally. While there is a community-based testing facility in Bloomington, to have one in this part of the state is actually also really important. And so it is open to the entire community at large, and it will be in those 3 locations within the city of Peoria.
One thing that Pastor Hightower brought the other day was transportation, specifically people that rely on public transit. I mean, there's a CityLink bus stop right across the street from here. I mean, has there any talk about ways to facilitate public transit to help people get here? Might not be in a physical condition to walk, and might also not have a vehicle.
So the question is about transportation to these sites. And the great part about Heartland Health Services as a federally qualified health center is they're very intentional about making sure that they eliminate barriers for all people to access their services. So all 3 locations they chose were ones that were accessible by bus lines, also had easy access from main thoroughfares in the city. And we are working with the city and Public Works to assist with any traffic control as well. And so it is going to be, as with this response has always been, a large community response.
Monica, the governor today said that schools are going to be closed, like in class, for the rest of the year. Are you guys recommending any graduation ceremonies be held at this time? And what does the city have to look like for schools to open up again next year?
So the question being, with the closure of schools, but remote learning still going on for the rest of the year, any recommendations for graduations? I think that's going to still be pending until we understand and watch this for the next 2 weeks, and even further on, what does that look like in terms of our case changing over time? Increased testing is going to make more identification of cases, and so I think it's too soon to tell. And again, there is still, even after we kind of come out of this, I think Representative Gordon Booth said it well, we don't have a vaccine and we don't have medication. So again, it's going to be recognizing that we are going to have to practice those non-pharmaceutical interventions for a long time to come.
I have a question for Chairman Rand, actually.
Okay. Well, I think we'll bring in Representative Booth first.
So kind of piggybacking off of that, no representatives from the schools here today. We know the governor gave, pretty emotional statement to kind of the students and teachers of our area. Just wondering kind of what your statement is to teachers and students that are really hurting right now.
Not just as a standing here as a state representative, but as the mom of a 5-year-old and a 17-year-old that are, doing the distance learning on a daily basis, and also trying to be a legislator and doing Zoom calls all day while trying to help your children. It is incredibly difficult. And so to all the parents out there, I want to give you a big attaboy, attagirl, and a big shout out, because this is not what anybody signed up for. And it's difficult, but we can get through this. As challenging as it is, I think life is all about perspective. And I think the perspective that those of us have that are dealing with the challenges of just doing our daily jobs and now being the principal, teacher, nurse, janitorial, short order cook, it's a blessing to be able to be in a position to do those things because there are so many people in our community that don't have the ability to do those things. It's hard, but we'll get through it. Again, school buildings are closed, but learning will continue. I think that some of the recommendations that came out were that really the idea that we have to provide the rigor of an actual school day, that's not accurate, right? So for a kindergartner, technically they're suggesting from ISB about 30 to 45 minutes per day. For a high schooler, 2 to 3 hours per day. So sharing that information, I think, is helpful in terms of relieving some of the pressure that parents are feeling, as well as our student population. And our school system is doing a yeoman's job of truly ramping up a digital learning platform in the matter of a week. It's massive and it's incredible, and it just shows that what we can do, what the American spirit can do in times of great need, which we're in right now.
What message would you give to high school seniors right now who are kind of missing out on those fun end of the year activities?
Life gets greater later. Unfortunately, this is a challenging time for everybody. And are you missing out a little bit on maybe your senior trip? Walking across that stage, for those of you that worked really hard to get those grades, yeah, I mean, there's no nuance to put on that. They're missing out. But teenagers, I promise you, if you continue to lean in, if you continue to work hard, I promise you life gets greater later.
Representative, you alluded a little bit to a lot of the work that went on behind the scenes to get these testing sites to come to Peoria. Can you just elaborate on that a little bit more, exactly what the effort was to get those here?
Certainly. So from the very beginning of this, we knew how incredibly important testing was. And as the days and weeks went by, that level of information and how important testing was just became paramount. So the work around working closely with the administration to figure out what the testing apparatus was going to look like, because again, they really didn't know either, because there has not been a great deal of support that has come from the federal government. So most of what has happened has really been from the work of the administration, working with hospital systems, working with the private labs that we have in the state. And so many of us were trying to be patient, right, around what it would mean to build out testing an apparatus across the state. But obviously, when the data was reported about 10 days ago with the overrepresentation of African Americans, Illinois having 13% African Americans living in the state, yet they were making up 42% of the deaths in the state, something had to be done. And so not just in the city of Chicago, but in other places around the state like Peoria and Rockford and Decatur and Champaign and Springfield and East St. Louis, those communities that have a high concentration of African Americans, what we wanted to do was we wanted to ensure that the same things that were being seen in Chicago as it related to that overrepresentation, we wanted to be sure that in our communities that there was adequate testing so that if there were going to be a significant outbreak within the African American community, we were very blessed here in this region to have such a phenomenal healthcare apparatus. And so we felt very confident that we would be able to respond, particularly in this community. I'll speak for myself. I was confident that our community would be able to respond to the healthcare need, but what we needed more testing. Many of us know individuals that, posed every characteristic of someone that actually had COVID. They just simply did not have the ability to get that test. And so, I want to give a lot of credit to the governor, his staff, but then also all of our local partners being led by Heartland for not just, part of the work is getting the governor to give us the green light to have the testing. The real work is building out the logistics to get this done, and that is all of our local partners that have done that yeoman's job, and I owe them a great deal of gratitude for that.
There's, I'm wondering if anybody considered, we're putting 3 sites in Peoria. Did anybody consider population down there? Instead of putting 3 in Peoria, putting 2 in Peoria, putting 1 in Pekin?
Well, I think that, so let me say this, the work that was done in order to get the facilities that are being made, that the governor announced yesterday, that work was led by the Illinois Legislative Black Caucus, and that work was done with intentionality around ensuring that minority communities and communities that have a high concentration of minorities living in it had the ability to access those tests, because not only overrepresenting in positive COVID cases throughout the state, there was also an overrepresentation specifically of African Americans as it relates to the deaths. And so obviously, as Monica's already indicated, folks living in Pekin certainly will have the ability to come to Peoria or have the ability to go to McLean specifically, but the intention around the efforts in getting these federally qualified healthcare centers around the state built out to do the work of doing the testing was specifically because of the disparity that exists within the African American community. I say that also saying that the tests are open for anybody, but that was why the concentration is in places like Waukegan, Peoria, East St. Louis, Champaign, etc.
But poverty is an issue in getting people in their car to go a long distance to like McLean County, or even to come up to Peoria. It's a 45-minute drive, really. So, there are a lot of poor people in Pekin too.
Absolutely. Poverty is a very real issue, and many of us fight the issues of poverty every day in the work that we do. But I think that, again, what the governor was responding to was the call that not just poverty, but the overrepresentation of what it means to have so many African Americans overrepresenting not only in positive COVID cases, but also in deaths. And this is not just an Illinois statistic. Nationally, it was a very real concern for many of us in this room, as well as the governor's administration. And so obviously the goal is going to be that testing be available everywhere, right? So in order to really be able to get our nation, but in particular our region, back to any level of normalcy, there will have to be testing that will be everywhere. And certainly the work of doing large-scale testing, it isn't over. And I don't think we should even talk about the issue of testing about this community or that community. It's really just a matter of how do you ramp up as many communities as you possibly can. Peoria was just the first.
So are there efforts to get it in some of these other rural communities as well?
There are efforts to get testing ramped up all over the state, absolutely.
Thank you.
Is there any additional questions? I think there was one for the chairman.
Goes without saying that there are 118, I think, representatives in the Illinois House of Representatives, and Central Illinois has the best. I know this entire thing Heartland is talking about today is because of Jehan's efforts with Mayor Lightfoot and others leading the African American perspective across the state to get testing to our most disadvantaged populations who have higher health issues. Comorbidities is the fancy word for that. And it's a blessing and an honor to see her come here today to do this. When she says she hears you and she sees you, this is job one for her. And nobody is getting community-based testing but a handful of folks. And it just happened, and she's led it. And Jim and I are blessed to live in a community where this is going to happen. So, cheers, Representative Gordon. Your question. Heading to notes. Did you miss our conference earlier? Go ahead.
At the end of 2020, you're talking about a population that is really at risk for this, and these people are all going to have to find new homes, and you're going to be, moving them, putting them at more risk by putting them out in the community for a while until they move. Did COVID-19 come into the discussion of that, and could COVID-19 affect the deadline for the closure of the nursing home?
So were you not at the press briefing, or did you not get our materials? Because in our frequently asked questions section, we cover a bunch of your suppositions there that are incorrect. COVID-19 is a public health crisis that's a pandemic worldwide. The county of Peoria was set in the latter part of 2019 to proceed with the work of the health committee and to begin our processes this spring on exiting the business. So COVID-19 has nothing to do with it. It is a unsustainable financial operation that we have, and while we have a 178-year tradition in providing skilled care services, the industry has changed greatly. Our investment into this in the last decade since I've been in public office is strong, and we will not exit this business until we find a qualified place for every single resident we care for. One of your suppositions there suggests that we would discharge ill or infirm people into the community where, well, you said you're going to let them go in the community. I just want to answer the question. We're not doing that. We're going to find, through a patient advocate, working with the family members or the responsible parties, adequate care somewhere here in central Illinois. That's what we're going to do. We're not going to discharge them into the community where they would be at risk for contracting COVID-19. That's almost ludicrous.
No, that's not what I said. I think my point was that you're right now in nursing homes, family members can't even go in and visit.
Correct.
So, but I mean, this moving is going to cause people to, they're going to be moved. They won't be able to be quarantined, at least for the period of time while they're being moved. It's disrupting this population. And I get why you're having to close Hendrickson homes. I'm not debating that. But I'm worried for the people who have to move. And I'm also worried for the people that are going to be living with the people who moved, who've been moved and possibly exposed to the virus in the course of their move.
Every single day, people are going to work caring for folks that are COVID negative and caring for folks that are COVID positive. However, residents of Headington are moved to their new home will be done fully protecting them and the care providers that are moving them using what are commonly referred as universal precautions. And all I can say is that your point doesn't have a basis. We don't move people or care for people in any context with a flu, any kind of a flu, quite frankly, without protecting them and the care providers as they're going from point A to point B. Happy to let you re-ask the question. What I heard you say earlier and what you're asking now, that they're adding up when I give you the clarification that no one is going to discharge these people into the community. We're going to hire an organization that helps us with patient advocacy, so every single family member and every single client is compassionately and professionally managed to their next facility. That does not presuppose, as part of what I thought I heard you say, that somehow we're going to expose them to some virus unnecessarily. That's just, I don't know where that comes from.
People don't always know when they're carrying this virus.
That's what universal precautions are, ma'am. The business I'm in, every day, we're moving patients, protecting them and ourselves. It's really without basis.
Chairman, I can maybe
Sure.
answer a little bit of this, too. So I think the other thing to note about, not necessarily just for Headington Oaks situation, but overall in our community, is that long-term care facilities have been putting in place for a few months now high precautions, not only for their staff, but their residents. And even right now, we do have clients and residents moving between nursing care facilities as part throughout the state and actually throughout this country in regards to this pandemic. And so all precautions are being done. That's why there is that high standards of universal PPE, checks for staff, checks for clients, because they recognize the fact that regardless if they're in one location or another, they need to make sure that their standard of care maintains. And so regardless of the Headington Oaks situation, our long-term care facilities that are dealing with various outbreaks, are moving clients throughout various residents to assist with capacity issues on a day-to-day basis and taking those high levels of precautions routinely. I don't know if there's any other questions. Otherwise, we won't have a briefing over the weekend, and I will see you guys all on Monday.